Good morning, everybody. So, I'll be talking about diabetes mellitus, and this is your assignment at the end of whole session after 2 days. You are expected to write on definition of diabetes mellitus, classification, clinical features, and a note on criteria for diagnosis of diabetes, acute and chronic complications of diabetes, and about glycated hemoglobin. I'll be talking diabetes under these headings, defining it, then classification, then clinical presentations, diagnostic criteria, the current ADA guidelines, chronic and acute complications, management of diabetes, and HbA1c. Diabetes is a Greek word which means dia means through and benin means to go. Diabetes mellitus means sweet. Diabetes literally means passing sweet through the urine. It is defined as a group of metabolic diseases. Okay, so let us now talk about the normal fasting plasma glucose. According to WHO, it is 75 to 110 or 70 to 110 milligrams per deciliter, and according to ADA guidelines, it is 70 to 100 milligrams per deciliter. So you can see a little bit of difference here with the upper limit. ADA believes that maintaining a stringent range ensures a better euglycemic status and better diabetic control in the long run. And most of the clinicians prefer ADA guidelines. The current ADA 2020 guidelines are available on the net. Please go and have a look over the Google. You can download the PDF. It comes by the name Diabetes Care. Now let's talk about classification. We classify basically it into type 1, type 2, GDM or gestational diabetes mellitus, and diabetes due to other causes. The type 1 diabetes is mainly due to beta cell destruction or absolute insulin deficiency. Earlier it was called as IDDM, insulin dependent diabetes mellitus, but no longer we call it by that name now. It could be idiopathic or immune mediated. Type 2, however, is due to progressive insulin secretory defect in the background of insulin resistance, also called as NIDDM. There were two types, there are two subtypes in that, obese and non-obese. Gestational diabetes mellitus is diagnosed in second or third trimester of pregnancy. Fourth is diabetic due to other causes. Neonatal diabetes, MODY 1, 2, 3 you have maturity onset diabetes of young, exocrine diseases of pancreas, and drug induced. Now, what was the reason for type 1 diabetes? Autoantibodies or GAD, glutamic acid dehydrogenase, which helps also is used in diagnosis, and usual age of onset is less than 30 years of age. These types of patients are more prone for ketosis, or the most common acute complication that type 1 experiences is diabetic ketoacidosis. Type 2, however, is due to insulin resistance seen mostly above 40 years of age and usually accompanied by obesity. Let us now discuss regarding the diagnostic criteria for diabetes. Okay, so now let us concentrate on this. In absence of unequivocal hyperglycemia results, it should be confirmed using repeat testing. Unless clinical diagnosis is clear, same test is to be repeated using new blood sample for confirmation. If there are any two discordant results, which is quite possible, the result above the cut point should be repeated. It's all based on the clinician's discretion.